tell you that you can interact. You can interact during the session because this is not an educational session. You can interact and you can ask questions. You can interrupt me while I'm talking. I won't mind. And you will tell me the tips also, so that when we are taking such sessions with other batches, I can tell them that there was a student who told me this thing. So be very smart and be very active during this session and interact a lot. Okay. So let us start. Why I have given this image, because right before the exam, this is the condition, this is the situation of the student, and I can understand it very clearly. The whole team can understand it. Why not mark it? Because we receive a lot of messages, and every message is mostly about the past papers. This is the huge thing for students, and everyone is quite worried how to solve them, how to get the answers, how to match the answers when there are different in the books. So let us do this very smartly. You can see that we have got this paper 1 and 2 distribution, and you already know about it, because I know that students are taking preparing the exam from the long time. And here you can see there are some minor subjects and there are some major subjects. How we can divide these minor and major subjects? You can see the subjects which are being only a minor part of the exam, like embryology, genetics, biochemistry, epidemiology, immunology, and biophysics, and microbio and clinical management. These are called as minor subjects for the preparation. But that doesn't mean that they are unimportant subjects. Can we call it unimportant? Who can tell me? Dr. Amani, welcome.
No.
Welcome to the webinar. These are not unimportant, but these are minor because the number of questions which are coming in the exam, usually, that is less. Actually, it is not a strict rule. It is not a hard and fast rule. This is just from the past years, we have counted that this much questions or this figure of questions they can ask in the exam. So you can make this part as the minor one, okay? And we have got 4 and 4, 8 subjects. But the major part is physiology, anatomy, endocrinology, data interpretation, pharmacology, and pathology. So what students do, they spend a lot of time on a subject from which there will be only 10 questions. And from those 10 questions, the topic on which they are focusing more and more, hardly 1 or 2 questions can come into the exam. So that is the mismanagement. So for the September candidate and also for the January candidates, I would like to suggest that don't do this mistake. Okay, don't do this mistake. Previously, students have done this mistakeful things, and they have got not very good score. So you learn from the experiences and advantages of the others. So spend more time on physiology, anatomy, pharma, patho, data interpretation, endocrinology. Okay. When you are so much worried over the genetics, so much worried, and the most notorious subject, biostats, when you are spending a lot of time and you are having extreme level of anxiety about this subject or the biochemistry or the ones from which they are not asking a lot of questions. I'm not saying that just leave these subjects and study others. I'm not saying this, but spend time on the subjects wisely. That's my point. Okay. So we have Dr. Alblora. Again, I'm very bad
Yes.
at the pronunciation. Dr. Alblora, welcome to the webinar. And
Thank
can you
you.
tell me that, do you like pharmacology? First
No.
question. Oh,
No.
you are my team. I also don't like pharmacology as a subject. But you know,
Yes.
Dr. Helmi's lecture was one thing which made pharmacology quite interesting and easy for me. And it happened to other students as well. But same goes for the biochemistry and statistics. Okay, so if a student is not liking a subject, but he is taking proper mentoring about it, then
Yes.
the subject, is desirable, and you can say that he will not lose marks over it, because this is a human psyche that if you don't like something, you will not spend time on that thing. I like clinical management, I like anatomy, I like biophysics, I like physiology. These are easier to understand and easier to remember, but there are challenging subjects as well. And for every student, the challenging subjects are different. For some, biostatistics is very easier, and for some, data interpretation is very difficult, and for some, anatomy is very much difficult. So, you are your teacher and you are analyzing yourself first at what subjects what subjects need more time and what subjects need less time. And this is the distribution of the questions in front of you. So make your study plan very wise. Okay. So this is the first thing for which when you are preparing for the exam, this is the first thing you are going to do. All right. So students, now I have some very important tips that how to revise for exam. September exam is in about 2 to 3 weeks, and the revision plan is something which will make the previous efforts useful. If one has read a lot of books and he has given time to a lot of things and he is unable to revise by any reason, if you are doing this mistake, just stop here, think about the study which you have done before and pick up those things and start revising. And I have some very useful tips. Let's just go through them, that how to revise for the exam. So first thing which we have already discussed is this, that give more time to subjects from which more questions are being asked. Okay, more time for the subjects from which more questions are being asked, because you are saving each and every mark for the exam. What's the second tip? Do not start reading new books. Okay, at this time, you don't need to pick a new theory book, a new SBA subscription. You sometimes, you're talking about the exam to your colleague or to a friend, and he says, oh, that person I have heard, he got an online subscription and he passed the exam in just 2 weeks. So just go and grab that and you will pass the exam also. No, that's not the technique for anyone. Oh, that person and those examples can be true, but this is not practicable and this is full of risk. Don't rely on a particular thing and do not start something new at this time. Just revise those things which you have read earlier. And while solving the questions, you can open the references from many books, but until you are able to memorize them, that's fine. But I know that you are not able to revise and memorize 4 to 5 theory books and 10 to 12 SBS sources. So be very, very wise and be very smart while picking up the theory books. And once you have done a theory book, now you can revise it only. Okay. At this time for September candidates, this is a very useful tip, that do not start reading new sources and do not start new theory books. Okay. Now, when I was a student, but is a very successful technique which I have seen many students doing. What's that? They divide the subtopics. There is a topic. You can say you're talking about anatomy. From anatomy, there will be 22 to 23 questions in the exam. This is the one thing. What is the second thing? It can be changed. They can have 30 questions from the anatomy. Who can stop them from doing this? This is not a rule, I have told you. So what you will do, that pelvis and perineum portion of anatomy is most important for MRCOG-1, because we are becoming obstetrician and gynecologist, and pelvic and perineum, anatomy of the pelvis and the perineum is the most important thing from the whole body. So what you will do, you will subdivide the topics. Write down the list of the topics, okay, from the anatomy. It is breast anatomy, it is anatomy of the glands, it is anatomy of the pelvic bone, the joints, the ligaments, everything which can be asked in the anatomy, you make a list. Then you sort this list into two things, easy ones and difficult ones. Okay. Then what you have to do with the difficult ones, revise the difficult topics which are difficult for you. They can be difficult for two reasons. What are those two reasons? One is that you might have spent less time on that topic. And second, that you have just less understanding of that topic. Nothing is impossible for you. There are just difficult and easy things. So the difficult ones, you have to revise them with your friends or the students who are studying in the study rooms. They can revise those things with their colleagues in the study rooms of med exam. So revising the difficult topics with your friends will make the whole list easy for you. Okay. I guess you have got this point. So I'm moving to my next step of the revision plan. Dua Khan is asking, are you currently offering some revision plan for September? Yes, I'm offering and I'm giving details about it. Okay. The other tip is that, the fourth tip is that do not spend hours on revising one topic, switch between subjects. This is the human psyche. This is our brain that we get bored of things very easily. I myself get bored of things very easily. And then what I do, Walaikum Assalam, Dr. Chaman, and welcome to the webinar. And what I do, I switch between topics. How I do this, if I have started pharmacology and I'm reading the pharmacology of the glands or the drugs which are acting on the glands, and now I am bored, but I want to keep the pace also, and I want to add knowledge from different subjects. So I will start the physiology of the glands then. Or if I'm reading the pharmacology of the GIT and if I'm getting bored, I don't want to leave the pharmacology at all, but I will get back to it after some hours. So I will pick one thing from another subject, and that is the physiology of the GIT. So this is a very smart technique by which you don't get bored and you don't leave a topic at all, and you just interconnect the topics, and you are switching between the topics or the subjects, but you are standing at the same place also. Okay, for January candidates, we have a very detailed introduction session on our website, and it's also on our Facebook guide group. So we will less focus about the introduction and things which are for the starter plan on this webinar, but I will give you a very brief detail in the end of the lecture. Okay. So here what I want to tell you is, I am suffering from a problem, I'm suffering from a disease, or I'm suffering from some challenging situation, and I want to solve it and I want to fix it. But there is some clouding type of confusion coming into my brain, and I just can't know that what is exactly the problem. So how will we be able to solve it? It's difficult for anyone to fix a problem if he doesn't know about the problem. What do you say, Mafia? Am I right? I
Yes,
guess,
definitely. You are. Yeah,
okay.
I can hear you. So yes, you are definitely right. I just want to add on one thing, that before adding that thing, I think we have to ask the student what they are thinking,
Yes,
that
I'm
how their
asking
problems
Dr.
can be
Dashti.
solved. What do you say?
Dr. Dashti is with us, and I remember she is working as a trainee in the UK. Firstly, Dr. Dashti will tell us how she is doing and how the work is going for her and how study for MRCOG-1, and then she will tell us that the statement which I've just shown is correct or not.
Yes, and definitely we will tell them that later on. We will tell them that tips and tricks how they can, study MRCG Part 1 with their daily routine.
Okay, yes, why not? Hello, Dr. Dashti.
Hello.
So how's life going, Dr. Dashti?
So I just started doing from the pre-recorded courses that you are putting in a group, and at the same time I'm looking at the actual revision notes, and if
Great.
something is in the book, I add it to my notes. I am taking my own note, and at the
Perfect.
same I'm solving the past MRCOG questions, and if anything is new in the questions answers, I add to my notes as well. So I'm making my own notes for every subjects, and
That's the real hard work you are doing, and I really appreciate the way you are describing the start of your preparation. It's the best way. I would suggest every student to study this way. Start with the lectures, combine it with a book, and make your own notes. Yes, you can continue, please.
And then I'm adding the answers that from the questions. If there's something points that I'm adding to them, because when I'm solving the question at the same time, I will find out which is the part that they are most looking at this for making the questions. And also at the moment, the topic-wise questions in your website is closed, but I hope that after the starting of the sessions from the 14th September, I will solve them at the same time as well. And
Yes.
then I will revise everything, and again then I will go for the recalls, which is the past paper questions, and also other maybe question banks like a BMG exam, an examination, and a start OG. For the subjects that are clinical, I started from the subjects that are easier for me and I'm familiar with them, like a clinical endocrine, because because of the previous background of the medical school, we are more familiar with them, like rather than embryology. But at the same time, I connecting them together. For example, if I'm reading thyroid, for example, mechanism of the labor, I'm going for the medications at the same time from the pharmacy as well. Or if, for example, for the preeclampsia, I'm going to medication for hypertension at the same time as well, to combine these together. And then I cover the pharmacology and pathology at the same time with each subject.
Fantastic. This is the perfect plan, and the way you have described it, you have made it very easy for other students as well. And now I will interact a little with Dr. Shabreen. Dr. Shabreen is one of our top students from September batch. Why I'm calling her a top student? There are other as well. I have a team of top students, but Dr. Shabreen is somewhat close to me because she's also my friend. Dr. Shabreen, welcome to the webinar, and let me just tell you that I'm very happy to have you here.
Thank you,
What do you
Doctor.
say, Dr. Shabreen? You know about the problem, you know the chunks of the
Yeah.
problem, you know about the thing clearly, then you can solve it, right?
Yeah,
Is it the right
actually,
statement?
yes, ma'am, that I will 100% agree with you. I think the major thing is that sometimes you're very confused as to what the answer is, and till you solve that one particular question, you're not able to move forward or get over the topic till it's solved. And so you will search multiple books, but your main reference guides should be Oxford and your NICE guidelines. And
Yes.
if possible, they have other British BASH guidelines are there, then British hematology guidelines are there. As much as possible to follow these guidelines. And still, if there is a question to ask, of course, on the study group, and as one of the mentors will solve it for you, and whatever the answer is, once they have explained it, then I think it's just a matter of rote learning. Certain things are just need to be remembered rather than try to find a lot of detail into it.
Yes. And we will discuss more in the webinar as well. I must tell you that they cannot ask all the questions in the exam. They have a limited capacity of asking only 200 questions. So all difficult questions will not be the part of your exam. And the structure of the exam and the weightage of difficult, easy, and average kind of questions, it is mentioned in our coming session, which is on 9 September, and that is motivation and de-stress session for the September and the January batch, and I think all the students can join it. So in that, I will explain how they ask the question, the difficulty index of the paper, I will explain it a bit. So right now, I have summarized and I have pointed out some problems which are very common. And this is something I've got from talking to the students who are taking the exam, what problems they face and what problem I faced when I was taking the exam. So these are some and they are right in front of you. The most importantly, students find this thing very annoying that answers are not available in the suggested theory books. And Dr. Shabreen has just told you that there is Oxford Revision Notes and Essential Revision Guide, which is your theory book, and it is available to every student. And then we have guidelines, and then we have British guidelines, and then we have nice guidelines. And when something is not available anywhere, and you have and it is consuming a lot of time, it's very annoying thing, and this is the biggest problem, I guess. The second thing, which is problematic, is different answers in different books. And you can't rely on anything. One answer is correct, obviously. One answer is more correct than other, but you can't rely on both them. So this is very confusing and annoying and irritating thing for me as well. Then Dr. Shabreen has told you that they search in the answers in the book and then they go to the guidelines and then they ask from the mentors as well. What happens? I know students have joined multiple social media sites and multiple social media groups on which different mentors are teaching you the different topics. So what happens when they are asking a question in different groups and they get different answers? So this is also a problem for students. So they are getting answers different from a person who they trust that he can answer you a better thing. So this is also the problem. What is the next problem, which is coming from the recalls itself or the past papers, the incomplete statements, and then the answer is not given in the option. So while we are talking about the problems, and the next thing is that we are solving them. The problems, when we will solve, we will talk about it, that from where these incomplete statements and answers are coming. So we will move to the next thing, which is actually very important, that students forget the keys after some days. Students tell me that we were solving a file from 2015 and 16, then we started 2017 and 18, and now we have forgot the one which we were solving before, or the 1 week before. We don't know the answers of 2015 file. This is something which I've heard from the students. And what else they say? The point number 6. They say that they made silly mistakes. Silly mistakes is the word which is used by the students most commonly, and I just keep on hearing that I got bad score in the topic test, I got bad score in the mock test, I made silly mistakes. Now we have collected all the problems, all the common problems the students are facing these days while solving the past papers, while preparing and revising for the exams. And now the problems are in front of us, and now we will fix them. See, there is a person, and he is looking at the puzzle, and he is thinking about solving it. So Faiza Ali is saying, worst problem, but great session for the beginners like me. Will definitely join the regular course for guidance. Welcome, Faiza, to the regular course. And I hope you are following what I'm saying. This is not for someone who is preparing from like 2 or 3 years. This is also for the beginners as well, because now you are a beginner, but after 3 months, you are going to take the January exam. So you are not beginner. Don't call yourself a beginner. You are the perfect candidate for the exam. So the problem number 1, 2, and 3, I am sharing that slide with you again. These 3 problems. Answers are not available in the theory books, answers are different in the books, and mentors are giving different answers. These 3 problems have these 2 solutions. What are those solutions? Always pick authentic book. Always pick authentic book. And the updated RCOG guidelines. In January batch, we have just got a problem. A person was saying that this is something which is written in the guidelines, and in the PDF it is different. And what was the issue actually? It was the issue that she was reading an old guideline. Guidelines are updated every year, and sometimes after some years they update their guideline. So be you have to be update you have to update yourself from the recent guidelines of the RCOG. Okay, and by reading authentic books, I mean that you follow the ones which are given by RCOG, that is Oxford Revision Notes and Essential Revision Guide. But also there are a lot of other authentic theory books which are written by some great authors, and we can follow that. And I must tell you that in Oxford Revision Notes, and mostly in Oxford Revision Notes, not in the Essential Revision Guide. In Oxford, we have got a lot of false information, because the last edition which we got, it was 2011, and they never updated that book. So what's happening now? The information is updated. We know that information is updated, but it is the old one which is written in the Oxford Revision Notes. So be very careful while picking up the book, and be very careful while following the book. So this is how you can solve your problem. And the other thing, which is very important, is that follow one authentic and standard study platform. Do not follow a lot of social media groups. You do not really need it. You only need one study platform where you can get answers with the references which make sense anywhere. I am telling you, anywhere. You know how to choose the study platform. This is also very important thing. So I can tell you that there are two important things which can help you choosing a platform from where you are preparing for the exam. One, there should be a team of mentors. Okay, there should be a team of mentors. Mafia, if you can just support
Yes.
me in this statement.
Yes,
having,
yes.
having a team of mentors is very important. If one mentor is busy and you are asking some question, other can come and help you and saving you from wasting your time, and you just get your correct answer. And if there is confusion between something, mentors can discuss and tell you the correct one. So team of mentors is
Yeah,
very best.
exactly. I just totally agree with you. Yes, Dr. Mehwish, basically the team of mentors or the mentor panel is very important. The main factor which I think is that the answer is like, the one answer is authentic. Like some of the students, in my experience, like in the past like 7 to 8 years, like we're helping the students to clear their exam for MRCOG-1. Student just get some old version books, and they just bring the questions, and if there is only one mentor, and sometimes, because we are humans, we do mistakes. So
Yes.
with the help of multiple mentors, we can get a one authentic answer. So the mentor panel, this way they will help a lot. Moreover, if one mentor, if you are taking guidance from one mentor, or maybe he is or she is like get some issue or some accident or something like that, so you must have some backup for you, that can help you in exams.
So on this thing, I want Dr. Ikra, who is also my friend, and she is in the webinar with us. I want Dr.
Okay.
Ikra to speak something about this. That Dr. Ikra, whenever you had some issue and you asked a question in the study room, are you satisfied with this thing that multiple mentors are treating you, or are you thinking that only one person should get the answer for you? What do you think?
Yes, ma'am. This is this is actually a teamwork, I guess. And all the mentors are very, they're very helpful to all the students. Whenever we face any problem regarding questions or different things, we post in the study group, and all the mentors are, we tag the mentors. We can tag a specific, like we do mostly tag you, Dr. Mehwish, but I have
Because
seen that.
I'm moderator as well. I moderate the
Yeah,
group as well. So
yeah, but
yeah,
others are
I
also
get
very active,
most
like
of the notifications.
yeah, exactly, and Dr. Helmi and Dr. Desiree and the other mentors. They are also very hardworking, and they are great people, because they are
Yes.
always ready to help us, every time.
So having senior mentors, having a team of mentors, and
Yeah.
the mentors who are ready to help is
Yeah,
the thing
basically
which you need to
it's a
use.
teamwork. Yeah, it's a
It's a
teamwork.
teamwork, yes. So the other thing which is very important while choosing the platform, the second thing is that if anywhere you are only getting the keys, they are saying this is the key, just cram it and go. And if this person comes into the exam, just write this key and you will get the mark. This is the bad choice. This is the bad choice. If someone is doing this with you and you are happy to enter into their course or their study activities, just change it immediately, because you need the answers explained. You need the references. You need to read the topics. The time has gone when students were just cramming the keys of the past papers and they went into the exam and they cleared the exam. That time has gone. I don't just believe that ever that time was there, but now exam is very logical. The questions which they ask in the exam are very logical, and they make minor changes in the questions. I keep on telling students that they do not repeat the questions as it is. They do not copy paste the questions from their previous question banks. They make very minor changes in the options or the questions. So you have to save yourself by reading the whole topic. Okay, this is very important. So what was the
Dr.
problem number? Yes,
Mehwish, sorry to interrupt you. I just
please,
want to
please.
add one more. I just want to add one more thing. I was telling you that all the mentors are very helpful. I just want to add that all the students, even we have a very hardworking and very great students with us in
Yes.
this. They help other students as well. Whenever we face any problem, they are just ready to answer, and they just support the other fellows also.
This is why we make study groups. This is why we let students interact with each other. The study groups are made on a very big purpose. All the students who are taking the exam, they have same potential, they have same energy, and they have same goal, and they are going towards the same thing, and that is the achievement of success in the MRCOG-1. So when all such people are combinedly staying in a place, the whole energy is combined. And this is, I also love the questions on which students are just coming and talking and giving their reviews about an option or an answer. I just love reading those discussions, and then they also get help from the mentor, and they finalize an answer, and they get references from different books. Study room is best place for the study. I would suggest everyone to just get into that and study for the January exam. Dr. Ikra has explained it very well. So we had this problem number 4, the incomplete statements and answers is not given in the options. What happens? From where these incomplete statements are coming? Actually, the recalls files, they are not given by RCOG, obviously. They are not given by some book author. They are actually the collection of the recalls of the questions from the students. They came from the exam and they wrote the questions in the Facebook group or somewhere, and some person just compiled them all and labeled it as 2015, 16, 17. So I have explained it that this is how files of recalls are made. So Dr. Saud is here with us. Dr. Saud is the candidate for January exam. Dr. Saud, after hearing about this explanation of the recalls files, do you suggest that this is a trustworthy source, or this is something which every student has to follow for clearing the exam? What do you think?
Yes, Dr. Mehwish, the one thing I have learned over the year, I even took USMLE Part 1 back in 2014. The only one thing that I have learned over the year is that you have to stick to one source. When you jump around to different sources, that's where you make the mistake. Because then you get confused, and then you have a lot of other questions. Why is one source telling you this and the other is telling you that? So I learned it the hard way, that you have to stick to one, and then you, like she said in the beginning, that you have to make your own notes, and then you go through your own notes. And then if you have to add something, you add to it, rather than jumping to one book and then go to another theory book. And I was the student that had to like you said, that had to see what was the new friend suggestion about a new, question online. There's a new pool, so you have to go through it 2 days before the exam. And I was sitting there sweating to attempt those questions, but nothing came from that pool. So it was a waste of time. It was a waste of time,
That was
waste
a
of
waste of
money,
time,
and
yes.
energy.
Waste of money.
I could have revised my material, my notes that I had, which were far better than what he suggested. So you guys are excellent. And I would say that you are the first, I told you before this, that you are the first tutoring institute that I have joined in my life. I've never had any tutoring group joined before, but you guys are excellent. Your team, your technical support team, the mentors, everybody's excellent.
So this is some very nice explanation about med exam also, and I'm just glad that you have joined and you are very happy with us, and I just hope that you get the success for which you joined us, and definitely you will clear the exam. Good luck, and thank you for the reviews, which were very
Yes,
nice.
thank you
And
so much, Dr. Saud, for such beautiful words. Our prayers are for you. Thank you.
Thank you, guys.
thank you. So I have told you that such questions are coming from the recalls, from the minds or the brains of the students who have taken the exam. Obviously, RCOG is not leaking out their pools. So the keys are doubtful. The keys which are given in the recalls files are doubtful. So the questions are, and so the options are. So nothing in the recalls file is trustworthy. Everything is doubtful. So what you will do when you will get an incomplete statement and the answer is not in the options, we label it controversial questions. We call it controversial questions. So how you do them? You just don't do them. Okay. This is the only thing you do with them. Just don't do them. Save your time. Read the topic from which that question is coming. It's like something is asked from the topic of the estrogen, and you don't understand the question and you find no reference about it. Just read the estrogen, the structure, the uses, the mechanism of action, the side effects, everything. Just read everything about the estrogen and leave that question behind. Do not get worried about such questions and do not waste time over it. Let me just check if we have Dr. Amar here, because Dr. Amar, he told me he's getting headache because he is trying to solve every question from the recalls files, and I think that's a huge project just before exam he has started.
Dr. Mehwish?
He's not here with us, but I'm just sharing the experience. Yes, please.
Dr. Mehwish, I have a question here regarding recalls.
Please.
Some people are saying that recalls are very important to do to qualify your exam, right? But now you are saying that they are not very, like you cannot rely on the recalls only. You are supposed to, clear your concept regarding the topics given in the recalls, right? Because we are not sure that the keys are authentic or the questions are complete with the complete threads and all that. We just need to practice those questions like for our practice, right?
They just lead you to important topics.
Important topics.
They just lead you to important topics which are being asked multiple times in the exam. So what happens? Why there is a misconception that RCOG repeats 80% from the recalls? This is not a good concept. This is not true actually. What they do, they repeat 80% of their topics.
People say that you cannot
20% is the difficult one, and the 80% is the one which got repeated and which is already given in the book. So what students think when they sit into the exam, they see the familiar topics and they think that the questions are coming from the past papers. This is not the copy paste. I'm telling you again and again. Okay.
Okay. Thank you.
So it was our problem number 5 and 6. You forget the keys after some days and you make silly mistakes. Okay, the silly mistakes word is, I have told you that it is very common with the students. Why a person makes silly mistakes? Again, Read the topics, read the topics, read the topics. When you have read a topic, you have got all the knowledge about it. There is Dr. Ikra, who is opening the book. She just got the information that half-life of luteinizing hormone came into the July 2022 exam. Okay. She was alert. She thought that RCOG repeats this question. So she just opened the book. And while reading LH half-life, she read the FSH half-life, she read the human chorionic gonadotrophin hormone half-life. She started reading half-lives of all the hormones, okay, from that chapter. And she kept that information into the brain. And then there was the one student, Dr. Mehwish, and she said, oh, LH half-life, this was like 30 minutes. Okay, if this question comes into the exam, I will solve it. This is 30 minutes, which might be wrong, okay, because this is the recalls file. And she just didn't bother to go to the book and check the information and keep the information into the brain. Okay, that's the you know, the worst example of a student, but Dr. Mehwish just did it. So now what happens after 2 weeks or 3 weeks, Dr. Ikra will remember everything which she just studied from the book. But Dr. Mehwish will forget the key which she studied on the Facebook group, that some student was saying LH half-life was asked in the questions, and that's it. So this is how you forget about the keys. This is how you forget about the questions, answers. When you make a concept, you can't forget anything. So read the whole topic. When there is a question being asked from you, and you should read whole topic and then revise that. Revise the information which you have got. And I can tell you that in your busy schedule with the work routine and the kids and the family responsibilities, because you are elder, you are a responsible citizen, you are a parent, you are a job holder, you have got responsibilities other than your own study. But I can tell you, if you make revisions, 3 revisions, if you can make 3 revisions of the whole course, you can pass exam very easily. So 3 revisions are the target for every student. And the technique I have told you, read the topics, just don't rely on the keys only. I just know about some social media groups on which, you know, they post a question and then one answer A, B, 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 C, 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 and they keep on studying this way. And I don't understand why they are wasting their time like this. They pick one topic and they discuss it with the students. That's the correct way of the preparation. That's the correct way of mentoring. So I don't understand that cramming the keys is like how much favorite to the students or the teachers. This is not the correct way, I would say. And again, discuss in the study rooms. The topics you come across in the past papers, discuss them in the study rooms. And the September students, they are doing it very successfully. I am just super glad by the depth of my heart. And I'm super glad because they all are studying in front of you, and there is a side of Dr. Mehwish, which is teacher only. See, I'm a mother, I'm a wife, I'm a teacher, I'm a daughter. So the side which is teacher only, it is super satisfied by seeing the students studying so well, so dedicatedly for the exam, that I appreciate them from the depth of my heart. And you know, I gave them a wonderful gift also. Martha, what was the gift? What was the gift we gave them? And they have
I
received
guess
it or not?
Yes, I think we have to make it a surprise. We will disclose this at the end of the webinar. What do you say?
Okay, okay, great. The thing,
Okay,
the next
fine.
thing, you have to interconnect the subjects. Interconnect the subjects is, you know, this is the word which is having everything in it. You are reading GIT physiology, then you read GIT pharmacology, then you read GIT anatomy. You know how you are relating the subjects to each other. And this way you will not forget about any subject. Interconnect the subjects. When you are picking something, for say you are picking estrogen today, Read the pharma, GIT, read the pharma, or physiology, or the anatomy, or everything about the estrogen, or the effects of the estrogen, or the structure of the estrogen, everything. So interconnect the subjects this way, and you will not forget anything. And then explain your answer. Explain your answer is the best strategy which I have done while my preparation, and I keep telling all the students that when you are answering, I give you an MCQ and you say A. A is the key. A is the answer. Then put a Y in front of your answer. It is A. Why it is A? Then you will explain it. And when you will explain it, you will see the difference. You will see the difference that how it will add up things into your knowledge, because then you will look for an explanation. You will search for it. You will search in the books. You will, grabbing the knowledge a lot. So these are the tips for the problem number 5 and the 6. And what were the problem number 5 and 6? Let me ask from a student. Dr. Nahida Najneen. Welcome, Dr. Nahida, to the webinar. And can you please tell me what were the problem number 5 and 6 for which we have got these solutions? Or else Dr. Yuki can answer. Dr. Yuki is also from our September batch, and again a wonderful student because I can see the efforts. Dr. Momali is here also. I guess everyone has forgot about the problem and they were so busy in getting the solution. So I can just go back and I can tell you what were the problem number 5 and 6 for you. So you can reread them. You forget the keys and you make silly mistakes. And for these things, we have these solutions. Okay. So the student was asking about the study plan for September MRCOG-1. Many few days are left, and I have organized a wonderful study plan. The team have organized this the wonderful study plan. This is right in front of you. It's covering all the modules, each module in one day, the live lecture, the questions, and the past papers. Actually, on the 19 and 21 of the August, we are done with the biostatistics workshop and the practice question session. And after that, we did all the past papers in our study room. And students, I told you that I'm appreciating them a lot. They shared all the possible past papers in the group and they made real good discussions about the answers. And from today, we are starting anatomy, then physiogenetics. So you can see on the 11th of the September, we will be covering all the subjects for the revision. One day is enough for the revision. How one day is enough? This is not practicable for a person to just pick a book and start clinical management and finish it in one day. But how it is possible? In a smart way, we will play the lecture or we can read the PDF and then we solve the question. That's it. The PDF and the questions, those are enough. And then we have from 12th of September to 16th of September, we have this wonderful workshop, important exam like questions workshop. And this workshop will contain all the important things. We will revise them. I keep on sharing questions for whole, like 5 hours of sleep are just spared. Other than that, I'm just sharing the questions and question and question. And in July workshop, students were wondering if I am able to getting some sleep or not. But the workshop is just close to my heart because after that workshop, students are taking the exam. So exam is so close and every possible important topic is touched during this workshop. Every possible important topic. The questions are 1,000 in this workshop because in one day we share 200 questions from different topics. And one day I assign to biostats only. And on that day, we will cover all the important questions of biostatistics. And for the rest of the days, all the other topics are covered. So other than those 1,000 questions, I share a lot of points in the group, easy and difficult both. So you can revise them. So these are the features of this workshop, 200 questions daily, 1,000 total. You can make this 14 hours. Mafia, this is 14 hours a day. 14 hours with the mentor, because
Yeah,
sharing
there was
200
a typo
questions and
mistake.
a lot of important topics, it takes a lot of time. Just 4 hours, this is not imaginable that you can cover all these important things in just 4 hours. This is 14 hours. All the important topics discussion and 1 day for biostats question only. Okay, it is starting from 12th September and it is ending on the 16th September. So the person who wants to take this study plan, he can go for that. From today, we are starting an ATME and he will get all the recordings and then he can solve the questions in the study room with us. And he can read the past papers discussion in the study room because he will get the access of the study room and the work with the website both. And then if a student do not want to take the whole study plan, whole revision plan, he can only go for this 5 days workshop. So let's solve some questions from past papers files, which I've compiled, and I want to show you that.
Yes, this is very exciting.
Yes, this is very exciting, and this is actually the main part of this webinar.
Yes,
So we
basically,
have got some.
these are
Yes.
free questions which are available on our website. You can practice it for free, and then you can, like, if you want to continue further, you can just drop in a message to us. These are free questions.
So question number 1 is right in front of you. This is very famous and very notorious recall question, exam-like question. Who will answer? Dr. Nimra, Dr. Yara, Dr. Ziba, Dr. Maliha? Anyone from you?
Yeah, Dr. Shabreen answered that 16 week. Dr. Jyoti 16 week. Dr. Amani 16. Okay, you can open your mics as well.
Yes. But
Dr. Momo
in a lot of
16.
places, I have seen 36 weeks as well. So what is the explanation for 36 weeks? Because
Dr. Sidra can tell.
Because ideally, everything is increasing in the pregnancy. Everything is increasing. So why not 36 weeks?
Mostly students are saying that it's 16 week. Dr. UK is saying 16 week, but only Dr. Sidra is saying that it's 36 weeks. So we have to ask the explanation. Dr. Sidra, can you please open your mic and just what makes you think like that it's 36 weeks? It's a chance you should avail, everyone. Please open your mic and participate.
That's fine. After solving this, we will check for the explanations,
yes.
okay?
Yes, Dr. Sidra is saying something. Please, Dr. Sidra, you can continue.
Please, Dr. Sidra.
I guess because more workload on mother body because of fetal, more blood returning from the fetal blood circulation. So I guess 36
Okay.
is that.
This is a good concept. So we will see that in what's written in the explanation.
Yeah,
Okay,
I
this
just,
is the next question. Yes.
Before going to the next question, I would request Dr. Mehwish, we can select that 16 week because most of the students are saying that 16 week. So let's see what
I
is
have
the correct
selected
answer. Yes,
16
yeah,
weeks.
okay, yes. Then we will click on the next button. It's exactly this website is dear all this website is exactly the same like you have your RCOG website. So
Yes.
what it is that you can adjust the time according to your need. Like if you want to practice all the question in 30 minutes, in 20 minutes, it's totally up to you. You can even practice free questions over here as well. If you need the link, let us know. Our backend team is Asma. Asma, can you please share the link of the new website as well?
Yes, please share
So
the
that
link
you
of the
can
new
practice your
website.
questions. Thank you.
This is another very famous and very confusing recall past paper question, and it is in front of you. So I'm getting answers. Nitrofurantoin, coamoxiclav, trimethoprim. Keep going, keep going. Trimethoprim, coamoxiclav, multiple answers. Keep participating, doctors. Even if the answer is wrong, you will get the explanation, right? Cefuroxime, someone is saying cefuroxime. Okay, coamoxicillin, trimethoprim, So a lot of students are in favor of trimethoprim, so I will mark it. Trimethoprim. Okay. And I don't know if it's the correct answer. I will also get the answer from the explanation. Okay. So another one, plasma concentration of estrogen increases throughout the pregnancy. By 40 weeks, the concentration of estriol increases to estradiol how many times? Focus on the question, but they are asking actually. If they're asking about the pregnant levels or non-pregnant levels, or they are just comparing two levels of different hormones. So what is the answer here? Dr. Ramani is saying that trimethoprim is causing, nitrofurantoin is causing the jaundice in last pregnancy. We will check. Okay.
Yes. It's 50.
We are
Most of
getting
the students are saying that it's 50 times. Yes, Dr. Ikra?
50, 20, 50, 10, 100.
Yeah,
50,
50
20.
times.
Let's see. So many students are in favor of this answer. So I'm marking it. Okay.
Yes.
So what are two major steroid hormones produced by the corpus luteum? Another very famous question for which I get a lot of answers, and today I will help you finding the correct one. So corpus luteum, everybody knows about the hormones of the ovary, but corpus luteum, what corpus luteum secretes?
HCG and progesterone.
Let's see. A lot of students were in favor of the option 50, so I made it 50. HCG and progesterone. Okay, HCG. Progesterone and HCG, estrogen and progesterone. So more and more students are in the favor of this progesterone and HCG. Okay, so I have marked this. And I don't know if it is the correct answer or not. We will just check. This is the last question. Action of messenger RNA. It was actually explained in the genetics lecture as well by me. So I just want all the correct answers. Let's see.
Translation.
Translation, transcription. Again, we have this 50-50 count. Now it's-
Translation.
Okay, translation.
Yes, Dr. Mehwish, you have to enter the name first. It's like you have attempted how many times?
This is not me who put the incorrect answers if they are incorrect.
Okay, these are the students. So basically what you have to write over here, that you can write attempt
Dr.
one
Mehwish
without
and
space.
students. What I have to write actually?
Yeah, basically it's for a number of attempts, like how many attempts you have
This is
done.
only one
Attempt one,
attempt.
attempt two, or like how many
Got
marks you
it,
have
got
gotten.
it.
Yeah, attempt one.
Oh my God.
2 scores only, not bad. So let's see the
So
answers.
where we went
first.
wrong. Let's see the answers.
Okay,
So the answer
16
of
weeks.
the first question was correct. GFR increases markedly during the pregnancy and peaks about 50% above non-pregnant levels by 16 weeks. Okay. A small decline may be observed during the third trimester, and this is the graph in front of you. You can see at the 16 weeks, the graph is getting the highest level, and then it is decreasing in the level. So 16 weeks is the correct answer, not the 36 weeks. Okay.
Yes.
Ideally, things are increasing, and a lot of times we get the peak at the term, 36 weeks or 37 or 35 is the peak for different hormones, but not for the GFR levels. So here, this is the explanation. And again, I've told you we have team of mentors and we have discussed it and we have finalized this answer for you. And this is the correct one. We don't give nitrofurantoin in last trimester for HDN. You avoid augmentin, especially in preterm babies, and third trimester because the risk of the NEC, that is necrotizing enterocolitis. In the management of UTI in pregnancy, the drug of choice in the UK is trimethoprim and nitrofurantoin. So the answer trimethoprim is the best one here. Cephalosporins has been shown to have resistance, and you know about the resistance about the cephalosporin thing. So the best answer was trimethoprim. Okay. I hope the confusion is solved. This is the first and second and third line and IV treatment and everything from the guidelines given in front of you. And when you open the website, you can read it all. So we will move to the next question. Oh, it was a big mistake. Plasma concentration of estrogen E2 from E3. That's the question here. 100 when they are asking about the non-pregnant and pregnant level. Okay, this is explained in our study room as well. They're only asking the concentration of estriol from estradiol, E3 from E2. That's it. And that's 10 times. Okay. And you can read it. The 100 times is for the non-pregnant estrogen concentration at times. Okay. Again, we marked the question wrong. What are two major steroid hormones produced by the corpus luteum? And a lot of students said it was HCG. But actually, this is estradiol and progesterone. This is the proof. This is the proof right in front of you. You can see that from the corpus luteum, the progesterone and this blue one is estradiol. These two are coming. You get corpus luteum after ovulation, right? After 14th day. So in the luteal phase, you can see the levels of these two hormones are raised. Only these two. Nothing about HCG. Nothing about HCG. Corpus luteum, the normal corpus luteum, this will give you progesterone and estradiol. Okay. So the correct answer is estradiol and progesterone. And again, we have this description from our genetics lecture. So I have decided to revise this whole topic. We have 3 types of RNA. Messenger RNA carries the coding instruction from where? From the DNA. For what? For making proteins. Proteins are also amino acids. So RNA is getting the instructions from DNA, and that's called transcription. And when this transfer RNA carries the specific amino acid to the ribosome to form the polypeptide chain, which is called as translation. So we will keep it very simple. The transcription is synthesis of RNA from DNA. Synthesis of RNA from DNA, or else you can say that RNA is getting the code of making protein, the instruction for making proteins from the DNA. And what is translation? It is actually simply the synthesis of protein from RNA. That's it. So you can say that the role of RNA is in the both of the procedures, but actually the action which the messenger RNA is performing is getting the codes from DNA. So transcription would be a better choice. All right.
Dr.
So we
Mehwish,
will
there
go
is a
back.
question that
Yes.
one of the students wanted to know the answer of question number 3. So can we share that again on the website?
Okay. This is the question number 3, and the correct answer is 10 times. Okay. I was actually thinking that students will be confused in the 100 and 10, but there were a lot of answers. See, Dr. Meliha is asking, RNA do translation. From the RNA, proteins are being made because they have the instructions. They have the instructions to make the proteins. So the main action of RNA is to get the instruction from the DNA. So we will go towards the primary action of messenger RNA. Okay. Students are already asking some questions in the chat box, and you can add more. Ribosomal RNA. Yes, you can say ribosomal RNA have a role in the translation. But the process of translation is just you are making proteins. The name of the procedure, we are labeling which procedure, translation, the synthesis of proteins from the messenger RNA.
So it was a good experience, basically solving live questions.
And, you know, I just want to ask that how students felt about it. Let me
Yes,
ask
we have, yes,
this
feedback.
too.
We have to take the feedback. They can open their mic and tell the experience. How was it? Yeah, Dr. Faiz is
Dr.
saying that the
Shiza can
experience.
tell, someone is clapping, someone is raising the hand. Okay, please.
Yes,
Please just open your mic and speak up. Dr. Faiza can speak up. Dr. Fatma
yes, you
can
can
speak
open
up.
your mics and tell the experience.
Dr. Jyoti, please take
Was
some
great
part in the
experience.
conversation. So what happens when you are reading and studying questions in the study room? Mentors are coming and they are correcting you this way. And they correct your concepts actually, and they add up a lot of information and knowledge into your questions. So what happens? You are not only getting prepared for the exam, you are getting prepared for helping others also. You will see such misconcept in front of you. Your friends can do these mistakes and you can correct them, in a very ethical way. And then you can help your juniors in their preparation. So this is the right way for preparation. This is how you solve the controversial questions, and this is how you solve the past papers. See, we have read about the whole of the topic. We tried finding a cause. We tried finding an answer from the references which are around. So this is the correct way of preparation for MRCOG-1, and this is the correct way of solving the recalls or past papers or exam-like questions. All right. Again, I am welcoming every student who joined this workshop, who joined this webinar, and I welcome all the students to the workshop as well, to our revision plan as well. Just join today, Dr. Sayeda Aksa. I'm very happy to see you in the webinar. And Dr. Thet has joined, Dr. Waleed Ahmed. Dr. Waleed Ahmed is here. Great. Dr. Fazana Bedki, Dr. Gina.
There is
Yes.
one student, she's saying that please discuss more problematic questions like this. It was an awesome discussion. So I guess we shall
For
tell
whole
them
20
that.
yes.
Yeah.
For whole 24 hours, we do this in our study room. So
Exactly.
why don't you just join the study room? And we have different study plans for different students. If some students want to discuss only the questions or the past papers, he can get the access of the study room only, or the website on which these questions are being uploaded. If one only wants to do the workshop, this plan is in front of you. If one wants lectures also, and he thinks that for the rest of the days in these 2 weeks, more than 2 weeks actually, he can revise everything from the website. So he can get this study plan. So we are totally flexible about helping the students, and we just take care that what student actually need. We do provide that. Study room is paid. Yes. Okay, Dr. Adeli. Thank you. Dr. Adeli Samya. Thank you. Thank you, Dr. Aksa. And now I just hope that the question answer session is over from the students, because today I had a lot of questions. I asked from the students, and the questions I asked, I had answered also. So I think the question answer session is already done. So I'm again very glad to have this very informative and interactive session with you. This was a nice conversation with all the students. Students gave us study tips also. And Dr. Dashti, Dr. Saud have shared the experiences with us that they are studying the international exams and what happened when they were preparing. And I'm really glad the students are admiring and appreciating the efforts of MedExam team Thank you so much, Dr. Asif. Again, you are calling me a gem, but actually these are the students. These are the hardworking students which make me and my team to effort a lot. And these ideas, like this webinar, when I and my team was planning this webinar, how this idea came, I'm just sharing with you. This idea came because students asked for it. Students ask answers for controversial questions. They ask for the tips and the strategies for the revision and the study. So this is actually you who are gems, and this is actually the students who are precious and important for us.
Dr. Mehwish, there is a question from Dr. Walid's side. He's asking that please inform which book is better, Oxford or Essential Revision Guide?
See, for the January exam, I would say study both. And if you have taken the subscription of med exam, you don't have to read the Essential Revision Guide, because from the Essential Revision Guide, we have already shared all the important points in our lectures. So in that case, only you will read Oxford. And if these are September students, I would say just do not read any theory books at this time. Just go for the lectures and the PDFs and revise the questions in the groups, and then revise the questions in the workshop. September exam is quite close, and you don't just open theory books for your preparation. Open the theory books when you need the reference only. Okay? Don't open the theory book for the preparation, but only for the reference. See, we have two kinds of students. Some are beginners and some are taking exam in 3 weeks. So I have answered for both of them. Okay, thank you, Dr. Bali.
Yes, we do have our free group. Asma, please share the free group links in the chat box so they can join the free group links. Either we do the discussion in the free groups as well as in the paid group. It's totally up to you that which plan you want to choose. You can just drop in a message. Our team just have shared the link of their WhatsApp numbers. Just drop in a message if you have any concerns regarding your exam, whether it's for September 22 exam or whether it's for the January 23 exams. We are always here to help you all. Thank you.
That's perfect. So what do you think, Mafia? Any other student who has got the question?
Yes, I think we have answered almost all the questions that they want to know. So students are writing for you that you have done a great job, and thank you so very much, everyone. So let's wind up the session.
Thank you so much for this great feedback, and I really get more energized when I get this positive feedback from the students. So you do the efforts for someone and they acknowledge them. This is the best feeling. Thank you so much.
Thank you so much, everybody. We will definitely arrange another session for you guys. So if you want another session, please drop in a message on our Facebook page or our official numbers. Then we will definitely arrange whatever is your query. We will solve you in the next webinar. Thank you so very much for joining. Take care. Goodbye.
And again, join the workshop, because I know the worth of this workshop. This is very important for the revision. This will keep you going, and you will you will not waste your time sitting in an anxiety state, and you will just study for the whole day. And that last week of the exam matters a lot for the revision. So join the workshop, and we will meet in the workshop now. Good luck, everyone. Okay, we can now.
Good luck. Good luck for your exams.
Good luck.
Thank you.
Thank you, Dr. Saud. Thank you so much. Okay, goodbye.
Thank you, Dr. Saud.